معاكم الدكتور هلال. يا رب تكونوا جميعا في أحسن صحة وأسعد حال.
In today's video, we discuss the importance of testosterone for males and females. Testosterone is a vital hormone in both men and women, though it's most commonly associated with men. Normal levels vary significantly based on age, sex, and other factors. Normal testosterone levels. When we talk about testosterone, one of the first questions people ask is, what's a normal level? The answer isn't a single number, but rather a range that can vary significantly based on your age, your sex, and even the time of day. Understanding these ranges is the first step in making sense of your health. Testosterone levels are measured from a blood sample. In the United States, the results are typically given in nanograms per deciliter, written as ng/dl. However, in many other parts of the world, the standard unit is nanomoles per liter, or nmol/L. It's important to know which unit your lab is using. As a rough guide, you can convert nmol/L to ng/dl by multiplying by 28.8. A doctor can always clarify this for you. Crucially, testosterone levels follow a natural daily rhythm. They are highest in the morning, typically peaking around 8 a.m., gradually decrease throughout the day, reaching their lowest point in the evening. This is why your doctor will almost always insist on a morning blood draw, taken between 7 and 10 a.m., to get an accurate and reliable measurement. Testing in the afternoon could show an artificially low level, potentially leading to a misinterpretation. Now let's look at the typical reference ranges for males. In prepubescent boys, around age 10, levels are very low, generally ranging from 7 to 130 ng/dl. During puberty, the body dramatically ramps up production. Levels increase gradually, and by the late teens, around age 17 to 20, they surge into the adult range, reaching anywhere from 300 to 1,200 ng/dl. This is the hormonal change that drives the development of secondary male characteristics. For adult men, a wide range of 300 to 1,000 ng/dl is generally considered normal. Levels typically peak in the 20s. However, it's important to note that after about age 30, total testosterone levels in men begin to decline naturally by approximately 1 to 2% per year. This is a slow, gradual process. So, a healthy 65-year-old man will likely have a lower testosterone level than a healthy 25-year-old, but both can be well within the normal range for their age. Now for women. While testosterone is known as the primary male hormone, it's also vital for female health, contributing to bone density, muscle mass, and libido. Of course, women produce it in much smaller amounts. For adult women over 19, the normal range is typically between 15 and 70 ng/dl. Similar to men, female testosterone levels also peak in their 20s and slowly decline with age, with a more noticeable drop occurring around menopause. Finally, interpreting these numbers requires nuance. The standard test measures total testosterone, but most of this is bound to proteins and inactive. Only a small fraction, called free testosterone, is biologically active. Sometimes a doctor might also test for free testosterone to get a clearer picture. Remember, a single number doesn't tell the whole story. A result is only meaningful when interpreted by a healthcare professional in the context of your symptoms, overall health, and age. Because of daily fluctuations, a diagnosis of low or high testosterone is never made from a single test. It always requires at least 2 separate morning blood tests for confirmation. Symptoms of low testosterone. When your body's testosterone levels fall below the established normal range, a wide array of symptoms can emerge. These signs often develop gradually over months or even years, and because they can be subtle, they are frequently mistaken for the normal effects of aging. Recognizing these patterns is the first step toward understanding your health and seeking appropriate medical guidance. The symptoms can be broadly categorized into sexual, physical, and emotional domains. The most commonly discussed symptoms relate to sexual function. This often begins with a noticeable drop in sex drive, or libido. It's more than just having sex less often, it's a decline in spontaneous sexual thoughts and overall desire. You may also experience erectile dysfunction, or difficulty achieving or maintaining an erection firm enough for intercourse. This is because testosterone plays a key role in signaling the release of nitric oxide, the molecule that triggers an erection. Reduced frequency of morning erections and a decrease in ejaculate volume are also common indicators. Physically, the changes can be profound. Testosterone is an anabolic hormone, meaning it builds tissue. With less of it, you may notice a decrease in muscle mass and strength, a condition known as sarcopenia. Workouts might feel harder, and recovery may take longer. Simultaneously, you might see an increase in body fat, particularly visceral fat around your abdomen. This is because testosterone helps regulate metabolism and fat distribution. Your bone density can also suffer, as testosterone is crucial for maintaining strong bones, increasing your long-term risk for osteoporosis and fractures. Other physical signs include a reduction in body and facial hair, and in some cases, the development of breast tissue, a condition called gynecomastia, due to a hormonal imbalance. The impact on your mental and emotional state can be just as significant. A pervasive sense of fatigue is common, a deep exhaustion that isn't relieved by a good night's sleep. Mood changes are also prevalent, ranging from increased irritability and a shorter temper to feelings of sadness, apathy, or even clinical depression. Cognitively, many men report brain fog, which includes difficulty with concentration, memory lapses, and a struggle to find the right words. These issues are often accompanied by sleep disturbances, such as insomnia or frequently waking during the night, which can further worsen all other symptoms. So, what causes testosterone levels to drop? The reasons can be grouped into three main categories. First is primary hypogonadism, where the problem originates in the testicles themselves. This can be due to genetic conditions like Klinefelter syndrome, physical injury, infection, or damage from treatments like chemotherapy. Second is secondary hypogonadism, where the testicles are healthy but aren't receiving the right signals from the brain's pituitary gland, or hypothalamus. This can be caused by tumors, head trauma, or certain medications. Finally, there are functional or age-related causes where levels decline gradually over time, often accelerated by lifestyle factors. Several risk factors can increase your likelihood of developing low testosterone. Obesity is a major one, as fat cells contain an enzyme that converts testosterone to estrogen. Chronic conditions like type 2 diabetes and obstructive sleep apnea are also strongly linked. Certain medications, particularly long-term opioid or glucocorticoid use and high levels of chronic stress, can also suppress production. If you are experiencing a combination of these symptoms, especially if you have one or more risk factors, it's a good idea to speak with your doctor. Because these symptoms are non-specific, a thorough evaluation and blood testing are essential for an accurate diagnosis, which we will cover in the next chapter. Symptoms of high testosterone. While low testosterone gets a lot of attention, having levels that are too high, a condition known as hyperandrogenism, can also cause significant health issues. It's less common than low T, especially from natural causes. The signs can range from physical changes to shifts in mood and behavior, affecting both men and women differently. Understanding these symptoms is the first step, but uncovering the underlying cause is just as critical for proper diagnosis and treatment. In men, the signs of excessively high testosterone can manifest across the body. Physical symptoms often start with changes to the skin, like persistent acne on the face, chest, and back, driven by increased oil production. Headaches can also become more frequent, sometimes linked to another serious consequence: high blood pressure. This hypertension is a major risk factor for heart disease and stroke. Another physical change can occur with the prostate gland, which may become enlarged, leading to uncomfortable urinary symptoms, like a frequent urge to urinate. The effects aren't just physical. High testosterone can significantly impact mood, leading to dramatic swings, increased irritability, and heightened aggression. Judgment can become impaired, promoting impulsive and risk-taking behaviors. While libido might increase, the overall emotional instability can strain personal and professional relationships, a phenomenon sometimes sensationalized as roid rage when linked to external steroid use. Paradoxically, having too much testosterone, especially from an external source, can harm reproductive health. The brain senses the high levels and signals the testes to shut down their own hormone and sperm production. This can lead to testicular shrinkage, a low sperm count, and ultimately infertility, a common side effect for anabolic steroid users. In women, high testosterone causes symptoms of virilization or the development of male-like features. Physical signs include persistent acne and hirsutism, the growth of coarse, dark hair on the face, chest, and back. Women may also experience androgenic alopecia, or hair loss on the scalp, similar to male pattern baldness. The voice may deepen as vocal cords thicken, a change that is often permanent. Other changes can include an increase in muscle mass and a decrease in breast size. Reproductive health is frequently affected. High androgen levels disrupt the menstrual cycle, leading to irregular periods or causing them to stop altogether. This is often due to a lack of ovulation, where the ovaries fail to release an egg. Without ovulation, conception is impossible, making infertility a common and distressing consequence of high testosterone in women. So, what causes these high levels? The most common reason is the use of exogenous androgens, like anabolic steroids. In women, the leading medical cause is polycystic ovary syndrome, or PCOS, a complex hormonal disorder. More rarely, high testosterone can be a sign of a tumor on the adrenal glands or, in men, the testes. These tumors can secrete large amounts of hormones and require immediate medical investigation. While many symptoms develop gradually, certain red flags warrant urgent medical attention. For women, a rapid onset of severe virilizing symptoms could signal a tumor. In either sex, a palpable lump in the abdomen or testes, sudden extreme psychological changes, or symptoms of a cardiovascular event like chest pain or shortness of breath should prompt an immediate visit to a healthcare professional. These are not symptoms to ignore. It's best to consult with a healthcare professional to address issues with testosterone levels. Did you find this video useful? Then, like it and share it with your contacts. Also, subscribe now and activate notifications so you don't miss new useful videos.